Okay, I think we'll get started. I'm sure there's more people. There is more people due to start to join, but we only have an hour, and I know we've lots we want to discuss. Um, so thank you so much once again for joining. And this morning we're going to be. This is the fourth webinar that we've run about understanding changes in primary care, and today we'll be looking at all things digital and digital access. And we're delighted to have our panel with us, and thank you so much for attending. And we'll come to you to do an introduction in a moment. So just a few housekeeping. The webinar will be recorded and uploaded to our website. If you use the chat function to introduce yourselves, because it's, we were in a room, we'd all be chatting away to each other. So let's find out who's in the room with us, which will be brilliant. And then if you can move over to the Q&A to ask questions, you should see that at the bottom of your screen. Because it finds it really hard to ask questions in the chat box. And then just so you know, the closed caption function has been enabled, and we just would be grateful if you wouldn't take pictures or screenshots of the panelists. Okay, well, I think that is the end of the housekeeping, so we can get going. So you're going to meet our panel. I'm going to let them introduce themselves first of all. And as they introduce themselves, they're going to speak for a few minutes each. So I'm going to come first to Dr. Minal Bakhai, who's going to give us an overview of how practices are improving digital access and the 3 routes to primary care.
Thanks, Rachel, and thanks everybody for having me. So I'm Dr. Minal Bakhai. I'm a GP and Director for Primary Care Transformation at NHS England. And it's great to be here with you. And it's actually really great to be discussing general practice, because I think that reflects just how important a service it is to all of us. And it will be no surprise, I'm sure, to everybody here that general practice is responsible for about 93% of contacts with the NHS. 1 in 10 of us has an appointment with general practice a week, and 1 in 20 of those are on the same day of contacting the practice. But we're also seeing rising demand and increasing complexity of need. And at the same time, we know that patient satisfaction with access has fallen, and we're seeing increasing levels of staff stress and burnout. And these challenges are widespread. And so modern general practice has been born from the innovative and hard work of practices, PCNs and their communities, and is the first step of a transformation journey to help people receive the right care from the right professional and in the right way, to also reduce fragmentation of care and improve patient and staff experience. And the key principles of modern general practice are inclusive access, and national policy is really clear on this, that patients should be able to choose the contact channel that suits them, so whether that's online, phone or in person, that each of these channels should be equitable, and that each channel should be highly usable and highly accessible to meet the diversity of patients and their needs. And we know that people use these channels dynamically. There isn't a single size fits all, and preferences often change depending on the urgency and the nature of the need and their circumstances. Secondly, in response to the rising demand and complexity of need, we need to ensure that we continue to provide a safer and fairer model of access. And that means better understanding patients' needs when they make contact. And so regardless of the contact channel that's used, asking some important questions to understand that need, to be able to assess risk and urgency and move away from a first come, first served approach. And by using this information to help navigate people to the appropriate service or healthcare professional first time, making best use of the wealth of services that we have and expertise available to us to support people's care holistically, including our social prescribers, our physiotherapists, pharmacists, nurses, phlebotomists, community, voluntary sector, the list goes on. But also doing this more efficiently. So we're both valuing people's time, carers' time and staff's time. And in the same way that there's no single size fits all contact channel, also responding to people's needs more flexibly, based again on the urgency, the nature and the circumstance. And that includes using messaging, technology, text messaging, telephone calls, video, face-to-face consultations as appropriate. And when we evaluated this dynamic approach, we looked at about 10.5 million patient contacts across practices working in this way. We found that patient satisfaction was higher, there was improved continuity of care, there was tailoring of care based on the need. Importantly, the mode of access did not determine the mode of response. And overall, the service was more responsive, with most patients receiving a response within 24 hours of contact. And what we found was that people were more likely to use digital access routes when they had a good first experience. And in the majority of cases, people were choosing to use digital access as their first point of contact. But really, really importantly, what we saw was that both digital and non-digital users benefited from the change. So by doing this inclusively and thinking about equity, everybody benefits. But I think it's really important to recognise this is complex change, and therefore realising these benefits means bringing together multiple different things: improvements in process, well-designed tools, good communications, training, and the skills to continually iterate and improve working with patients and communities. And so the Primary Care Access Recovery Plan brings together some of these key enablers to help achieve these improvements. So by investing in higher quality telephone and digital access systems, transformation support, training, public communications to support the change. But a key national priority and core to this is improving the usability and accessibility of digital access journeys for patients, because we know that if you have a highly accessible and usable digital journey, it can increase digital inclusion. It can provide patients with more control over their care, increasing access to self-serve options, self-referral options as well. It can support that improved care navigation. It can relieve pressure on the telephones for those that really need it. And it can reduce some of that avoidable work that we know all our patients do to help coordinate care, but also release time for practices to be able to focus their time where it's needed most. And we know that if you have low usability and accessibility, it disproportionately impacts those with lower literacy, lower digital confidence, lower income patients, and patients using accessibility software and tools. So it is another social determinant of health. And we also know that if users get stuck in their first steps, it massively reduces confidence in accessing services digitally. So over the last 2.5 years, we have undertaken extensive research with hundreds of patients, particularly those with low to moderate digital confidence and skills. And firstly, we set out to understand what was important to patients and where do we need to focus the improvements. There are many reasons why people contact their GP practice, but actually the vast majority contact to achieve 7 things. So they request help using an online form, make, change or cancel an appointment, order a repeat prescription, get their test results, find out contact details for the surgery, request a fit or sick note, and to register as a new patient. And so these are the 7 priority tasks or pathways. These are the critical journeys that we need to focus on improving first. So then secondly, how do we improve the journeys? What are the things that are going to make the biggest impact to make them easier to use and more inclusive? And there were 4 key areas that have emerged. So firstly, designing around users' reading and language need. So reading is a significant challenge for some patients. 7 million adults in England have very poor literacy skills. 11 million UK adults lack the skills to use digital effectively. And what we're doing is we're moving from a verbal route of initial communication to a reading and writing route. And that requires very thoughtful design. So some online journeys that we tested in the research involved large amounts of text, questions, content, reading, comprehension, which can pose a barrier for some. And so we need to keep to a minimum the volume of written content that needs to be read and understood by people. The clarity and simplicity of the language used is also really critical. And that written content needs to follow guidance set out in the NHS Content Style Guide and meet a reading age of 9 to 11. Secondly, it's not just about the words, it's also about how that information is structured on a page. It needs to be well structured with clear headlines, clear calls to action. It needs to be straightforward to find and start, clearly labelled, and there needs to be a clear way back home for users. And these are all things that are outlined in the NHS design standards. So that adherence to those standards is really important. Thirdly, we mustn't overlook the accessibility of content. So often you'll see lots of images on websites, but actually images can be a real barrier to accessibility. So we should be avoiding images that are purely visual or decorative. Images that provide information need to be fully tagged, so that users of accessibility tools can access that information. Avoid clickable images, avoid PDFs because they're not very accessible. And then fourthly, communication. So really explaining clearly how and when patients receive a response or what to expect. So what time frame their requests will be assessed within, how and when they'll receive a response, and an acknowledgement of the request. So what are we doing about all of this? Because I think that's the important bit. So firstly, we are setting standards. So we have set standards of what good looks like. We have worked with suppliers, and suppliers have been really great in embracing this, in updating their products to meet these standards and improve the usability and accessibility of these tools. We've been working with commissioners and systems, and again, systems have been brilliant in embracing this and supporting them in prioritising usability and accessibility as part of their commissioning process. We've produced guidance and tools and published the research to help support them do that. And we've also produced benchmarking tools or auditing tools. So we produced a tool to audit practice websites. We've audited over 2,000 practice websites now. About 2,000 practice websites have now updated to a more usable and accessible website template. All the key suppliers in the market have updated their templates so they're much more usable and accessible. So we're starting to make headway on this journey. Then secondly, we're supporting practices and PCNs with the inclusive implementation of these digital tools and their communications. We've got the National General Practice Improvement Programme that provides hands-on support to practices and PCNs to implement this learning. We've produced good practice guidance, tools and resources and a series of webinars to, again, help support practices and PCNs on this journey. And we've also produced communications and copy text that practices, PCNs, systems can use that meets all of the NHS style design, content style design standards, and literally tweak and adapt to their needs. And then finally, we've heard a lot about ensuring that inclusive access is a key priority. And so commissioners are aware of this. It's in the recovery plan for primary care, and it's also set out and outlined in the GP contract that patient choice of channel and parity between online, face-to-face and telephone access is key. But I think finally, we're on a journey. And I think we're on this journey together, and we need your help in making further progress along this, in really creating those patient-centric digital journeys. And so I guess if I was able to have a few asks or calls to action, some of the key things that I've heard have been incredibly helpful are where patients have lent in to help their practice explain the changes to other patients and test their communications, to be digital champions and provide some of that digital support for some of the more vulnerable groups. To share lived experiences from the unheard and more vulnerable groups, but also asking the ICB, how they're supporting their practices, whether they've audited the GP practice websites, and what improvements are going to be made to some of the digital journeys to make them more usable and accessible. Rachel, I think you're on mute.
I am. Thank you so much, Minal. That was just really, really helpful to set the theme. Mizan, I'm going to come over to you now for you to introduce yourself.
Yeah, sure. Thank you very much, Rachel. Thanks, Minal. And a very good morning to everyone. My name is Mizan. I'm a GP based in London. I also work in the General Practice Improvement Programme, helping practices and PCNs try to improve their systems. And I am a senior honorary lecturer at Queen Mary University of London. I'll share a few slides, and what I'll be talking about is how my practice in Leytonstone, our practice in Leytonstone, tried to implement some of the principles that Minal was discussing with you just now. So we are a practice with about 8,000, we serve 8,000 patients, and we are quite a close-knit team. And like many practices, since over the last few years have been quite challenging. We've been seeing rising demands. We have been seeing a telephone system, which is just getting busier and busier. And from the patient experience point of view, the wait times are getting longer. Patients are understandably getting quite frustrated. And the real challenge is, when patients do eventually get through, if it's after 10 or 11 a.m., there aren't any appointments to give. So, our reception team are getting stressed, trying to negotiate alternative areas where they can signpost our patients to. Where needed, extra patients are being slotted in. So, that's adding to staff pressure. So the system really wasn't working. We were trying really hard. Our patients, were very, very understanding, but we knew over the last few years things were not working. An audit of how many patients myself as the GP I was seeing demonstrated that about 25% of the patients that I was seeing perhaps could be seen by other members of the wider primary care team. At the same time, and conversely, some of the newer members of the primary care team, such as our paramedics and our social prescribers, we were not really using them as well as we should. So half of their clinics or a quarter of their clinics were empty. And there was a lot of intelligence that came from the annual GP patient survey for us as a practice. What the survey demonstrated was patients were finding it extremely difficult to get access, to kind of get through the front doors, so to speak, whether that's via the telephone, physically coming in, or via digital routes. But once they actually came in, they really appreciated the care. So our scores for access were lower than average, but for care provided and trust were higher than average. So what I'll be really kind of sharing, as I mentioned, is how we've started a journey to try to address a lot of these challenges, not all of these challenges, to hopefully deliver a standard and a level of care that we would want for ourselves. And I think that's our core principle. If we can provide a level of care that we would be happy for ourselves and our loved ones, then we think we're doing a decent job. So we had a lot of conversations with patients, with clinical staff, with non-clinical staff. Initially, it was, more about, the challenges, the problems, this isn't working, that's not working. But later, it became constructive. We were very much of a mindset that, fair enough, there are things that we can change and there are things that we can't change. So let's try to focus on the things that we can have a level of influence on. And these were our aspirations. We wanted an equitable appointment system based on clinical need. Minal mentioned that sometimes there is a bit of a first come, first serve. So if you're extremely astute, you know how the practice system works, you'll probably get an appointment. If you haven't contacted us for 6 months and you really need help for your little one who's unwell now, and you call at 9:30, good luck to you, because the chances are all the appointments have probably finished by then. So we wanted something based on clinical need. We know we have a finite resource, and we really wanted to allocate that based on need. We wanted clinically supported care navigation. So I think our receptionists have a lot of burden in general practice, and they were being asked to make all of these difficult prioritization decisions. And one clear message was they needed a bit of help. And thirdly, we wanted to reduce the 8 a.m. rush. We wanted to reduce the overall number of calls coming in. We wanted to improve the use of the non-GP and non-practice nurse roles, and fundamentally a better patient experience of accessing care in the practice and improve staff well-being. So what did we do? So fundamentally, we spent a lot of time engaging our patients. We had a lot of conversations with patients. We kind of communicated that we've taken a lot of feedback from them. And this is what the new appointment system looks like. It uses a digital tool called Clinique. Between the hours of 7 a.m. and 4 p.m., all the requests for medical needs or other needs are submitted via an online system, and you can do it via your phone, you can do it via a desktop or a PC. If you, for whatever reason, as a patient of ours, you can't access it, you can call us, and our reception team will very kindly, fill that with you. They'll take the time, and that was a core principle. We wanted to make sure no one's excluded. And if you wanted to come in, you could come in and we would help you complete the form. So those requests are all then processed. They go to one senior GP, for example, myself, and two GP assistants, and we would prioritize them. Some of those requests would be purely admin, and the admin team will sort them out. Others would be of a low level clinical nature. So the other day we received one that said, somebody has a few spots on their chin and it had only started about a day ago. So that's something I could signpost very easily to the local pharmacist. And then we would categorize the other needs based on non-urgent and urgent. And we've been operational since October, and honestly, it's been life-changing. I've never been as proud of serving in the NHS. The last few years have been difficult because despite our best efforts, what I've found is the standard wasn't where I would want it to be. There have been cases where, for example, a worried mother had submitted a request for her 3-year-old. At 1:30, it would arrive at my desktop at 1:31, and I'd get my GP assistants to call that mother at 1:32 to bring the child in. And it's literally a 1 or 2 minute turnover for clinically urgent conditions. There are examples of conditions that we may have missed in the old systems, or a child, a 15-year-old, who had pain in his groins and then pain in his abdomen, but they had started to get better. And in the old system, when they contacted us at midday, we would not have had any appointments. We would have, at best, we would have booked them in a few days' time or a week or 2 weeks' time. But my colleague who assessed that request thought 15-year-old child, problems in the groin, let's bring that patient in. It could be a clinical emergency called testicular torsion. And indeed it was. And that child was sent straight away to the hospital, had his surgery, and he was well. So we've got quite a few case studies of where this system has really helped based on our ability to prioritize. So we have a good feeling. Patients are giving good feedback. What's the data saying? So on an average week, Mondays and Fridays are our busiest. We get between 100 to 120 contacts from our patients. About 50% of patients, those contacts will be converted to face-to-face appointments with clinicians. 25% will be telephone consultations, and 25% will be messages or signposting. So these might be things like requesting a fit note or some test results or repeat medication or a problem with medications. And this is what the data is saying. So in conclusion, the data has been extremely reassuring. We are dealing with about 90% of our patient demands on the same day. And for clinically urgent demands, 100% of those demands are being dealt with on the same day. The GP avoidable appointment audit went down from 25% to 5%. So only 5% of our patients perhaps could be seen elsewhere. So we're making best use of our capacity. There's been almost a halving of the number of phone calls coming in. Call wait times has reduced. So the percentage of people who used to wait for more than 10 minutes was around 40%. Now it's less than 3%. We want to get that to 0%. So it's still a work in progress. And our unanswered call rates has gone down from 14% to 6%. And now the core metric, our patient survey. So we've surveyed around 500 of our patients. About 90+% are satisfied or very satisfied with the response times. More than 90% are satisfied or very satisfied with the care received. 65% deem the new system to be easy or very easy to use. So there have been a lot of feedback about the actual system. Some have said it's a bit cumbersome, it's a bit clunky, there's a few IT systems, and that's something, I mean, it's beyond our immediate kind of sphere of control, but it's something that we're definitely going to think about. And my practice manager is delighted. The 3-month period before this new system, she had around 7 written complaints about access. In the 6 or 7 months since, she has had 0. So in summary, we're really happy with the system. Our patients are really happy with the system. It's possible to use these new tools and change our systems to deliver much safer care. And this for us is very much a work in progress. So we hope to build with this and take things further. So thank you very much.
Mizan, thank you so much, and it's great to see how you've been working in partnership with patients to develop the system, but also to see that really good feedback. So we're now going to move on to Cath, who, there you are. I just couldn't see you on my screen. I was worried. Cath, can you introduce yourself?
Hi there, so my name's Cath. I'm one of the senior IT leads here at Bay Medical. As I put in the chat, I like to call it the Lancashire Riviera, a little bit of a sunny hotspot at sometimes, but not always. So, Mizan, it was great news to hear about what you put in practice there at your surgery. You know, and Manal, she's absolutely so eloquently said it about the pressures and the challenges that we're facing at the moment. And you know what? I know digital isn't for everybody, but it is for a lot of people, and it's very easy for some. But we do have to forget. We're not forgetting the ones that don't that find it a challenge. So we're not saying we're leaving you behind, but it's just that if you can, please embrace our digital journey, because you know what? Here in practice, we find it's such an advantage. And actually, it works really, really well for us. And it works really, really well for a majority of our patients. You know, and this is where these great forums are put in place, is to remind us and give us some good stock that, you know, let's not forget about the ones that can't come on our digital journey together with us. So a bit about me, because I absolutely love everything to do with digital. I like to, I'm a talk guru of digital upskilling. And that's not only just for me, myself, every day's a learning day, but also, you know, for my colleagues here at Bay Medical, but most importantly as well for our patients. So I like to call myself a bit of a digital navigator as well. So I'm always on hand for patients who just need that little bit of extra help, or who think that they've got some challenges, and I will help them, no problems. In Lancashire, we're so great to be able to collaborate with Age UK Lancashire. And what we do is we've got this great collaboration where we work together to help digitally upskill our patients. And that can be actually digitally helping in the home. So we come to a decision that the patient would really benefit from that help in the home, and then the dialogue starts from there. What we really do as well at Bay Medical is that we actually really, really advocate the use of the NHS app, and it has worked absolutely phenomenally well in our surgery. And to me, it's the number one go-to app. I like to refer it to as a one-stop shop of fabulousness. That's my go-to word. That I love that word, fabulousness. Have I just made it up? Probably. I don't know. I still love it anyway. But to us, the NHS app has really helped us and our patients. You know, Mizan as well, we face the same troubles that you do about accessing our services. And to us, since we've introduced the app, we're growing from strength to strength, with actually patient participation, but also as well patient strength, that they actually like using it. So for the ones that can use the NHS app, they can really access our surgery a whole lot easier. Like you, Mizan, let me give you a stark fact. On one particular Monday, we had a 75-minute wait on our phone line, which is absolutely like a stab to my heart to actually give you that figure there. But that's probably was quite a natural occurrence. Every Monday, 75 minutes was probably actually the norm. So like Mizan, we actually offered that we started with online, our digital front door, where we offered our new way of working, which was that you could submit requests. On that day that it went live, which was also a Monday, I don't know why we choose Mondays to go live with dates. It's like it's a whole load of hurt. But actually, on that first day that we went live, our telephone queue reduced from 75 minutes to 29, leaving those who can't use digital, or who don't want to, or have real challenges or barriers using it, to actually wait in a much smaller queue of 29 minutes. Someone put in the Q&A, which I frantically went off and got my calculator out, that actually on that day as well, 861 patients submitted a request online to seek medical help. That can be all sorts of reasons, but 861 patients did that. The whole day appointments that were submitted, and that was either by calling in person or actually on the phone, was 1,238. I tried to work it out. I hope I'm right. which meant that 69% of our patients actually submitted an online request that day, which is absolutely so music to my ears, that actually we're embracing the digital revolution and that actually it does work. It can reduce phone queues, it can reduce queues at that surgery. And for the ones who can't, there are still the options of phoning up or calling in face to face. But those queues in reception and on the phone will actually reduce if you can embrace the digital revolution. So I know today's about, trying to advocate the use of digital. Yes, I understand it's a barrier to some people, but not to everyone. And if we can get more people embraced with the digital revolution and how it works in your surgery, then it will be better for us all and for the ones who can't embrace it so easily. So my quest for you today, guys, is if you haven't already got the NHS app, please download it. It's absolutely the best thing in our opinion. It's, you can do everything on it. Like Minal said, the 7 reasons why people actually contact the surgery. It can all be done on the app in our surgery, and I hope it can be in others as well. I hope you found this talk very interesting today. We just totally love the NHS app and everything that it extols about the NHS. And I am completely proud to work as well for the NHS. It's a different day now at work. It seems so much easier. We still have our challenges, but hey ho. So thank you for inviting me today.
Well, Cath, your enthusiasm about the NHS app is fantastic, and it's great to see that collaboration with H UK in your local area as well. And we are talking this morning on the eve of us sending out our latest report on the NHS app, which is pretty positive with recommendations in there. Amin, last but most definitely not least, you've heard all of this. You're going to introduce yourself and you're going to give us some reflections.
Thank you very much, Rachel. Good morning, everyone. My name is Amin, and I'm a patient representative. I'm also a carer. I have to say that I'm a great beneficiary of NHS, and I also have some personal health issues, and I also take care of my elderly parents. They have disability and long-term health condition, which require us to use NHS service on a regular basis. And I'm also juggling my full-time roles, caring role, as well as my employment. I've also been involved with patient association for numerous patient and public engagement workshops, and I cannot thank them enough for giving me the voice where I could share my and our family's lived experience and the difficulty that we face in terms of accessing the healthcare. But today I'll be talking about the NHS app. So NHS, I think, has taken a bold step in giving patients some autonomy and choice of accessing their own healthcare record, enabling with the mobile app on their fingertips. I think as a patient, I'll talk about my personal experience first. I find NHS app is very helpful tools to navigate some of the service provided by my GP surgery instead of waiting for a long telephone queue. And I find sending an online request as well as requesting my medication, which is very helpful. And I also do have partial size of my full medical record, not exactly as would someone be able to see from the GP surgery. So that is something definitely helps in terms of improving my patient experience. However, barely you can find any appointment which is bookable through the app. And before you know it, they're just gone. And I know there is a huge demand in the early morning. Everyone is queuing up. That doesn't work for everyone and all cohort of patient. And about the app and its functionality, my personal experience and reflection on it would be, when you log into the app, there are many things. It seems a bit overwhelming. There are so much information there. And as a carer, from the carer point of view, although the app provides some flexibility to manage my personal care need itself, the app itself creates huge disparity, in my opinion, because there are many things that something were normal in the past that we could do over the phone. Because of the digitalization, you can't do them at the surgery over the phone, and the phone queue line is constantly getting delayed every time when you get someone to answer your phone call. So one example I can bring up here, my dad was recently referred to the neurology specialist. So when we actually went for the appointment, and the specialist was looking at my dad's referral, he was informing us that GP failed to provide all the necessary information. Then I promptly asked him, we have access to the healthcare record through our mobile app, which is NHS app, whether the consultant would like to see it. The answer was they would not be able to accept the information that is accessible from the mobile app, because that wouldn't give them the full scenario of the diagnosis. So that is something I think if my dad had full access to his healthcare record, probably we could have prevented the waiting time, rather than maybe going to see the same consultant after 3 months times later. And about the booking appointment, I think when you contact the surgery, because you don't have any double appointment bookable. My parents, they have lots of, complex health needs. And when you try to book appointment, you can only book one appointment. The system doesn't let you book double appointment. And
yeah.
And if I can't book double appointment and we need, the language services, we actually potentially cannot fulfill the needs, the clinical needs of my parents. And if I'm lucky enough to get an appointment, and through the app, we get to see, I'll be frankly honest, that grumpy face of the clinical professional, because they're not quite happy because we just booked only one appointment, and that is not enough for them to do a thorough assessment. I don't blame them. I think sometimes you also need to think about how we can develop and design the system. Also, I think there are a few other things that NHS app provide you the access, especially when you look at the additional functionality other than the booking appointments and requesting repeat medication. Especially when you look at the secondary care, the referrals, you can contact the other healthcare provider. But actually, these functionalities are there, but actually they don't make any sense. My dad and mom, they both had appointment to the gastroenterology. We could not either book through that app, nor we could see there is an option for them to choose any appointment. So in my opinion, those options are there. It's just extra lines actually without adding much value to the patient experience.
Amin, thank you so much.
Would I be able to ask a few concern and question on that?
Yes, in a couple of minutes, if that's okay. Amin, I'll definitely come back to you for some questions. I just want to get to some of the audience questions as well. Do you want to start off? Do you want to start off with one question?
Sure. So my question would be to the developer and NHS people, how they could expect a 75-year-old man who is visually impaired and also disability can access this NHS app. And second one would be, if there are similar services already available, for example, patient access, there is the app provided by Acton, or the EMIS provides pretty much the same services to the patient. And I have been using that same service for decades now. And now we have NHS app. Why couldn't we have some sort of collaboration with the current provider, or maybe bring some unique sets of innovation to this new app and development? And the third one would be, there is an option where you can sign up for the research, but the app itself doesn't tell you who are you, what are you signing up to for, whether these researchers are the clinical or medical researcher or the market researcher, because you're giving your information, but you're not fully assured who is accessing those information. Thank you for listening.
Amin, thank you so much. And I'm going to theme your questions, because there's theme from what you just brought up in the chat box. Thank you all so much for your presentations. And like I just said, we did just we are launching our report on the NHS app tomorrow. But just some of the areas that came out of the survey where I think there is a willingness, which I think was one of the asks. Those who help others to use the app requested more support to enable that they were able to help people use the app independently. There, the kind of recommendations were increase the awareness of the app. And there's a question in the chat box about you can get it from your you can get on the app from your laptop, yeah. It's not just a phone, and there is a belief out there that you can get it is just the phone. There's an issue that's come up in quite a few questions, and it is a recommendation to Minal, and you might want to come back to this in a second, which is about providing universal access to information. This is patients' information, and I felt that in some instances GPs were acting as gatekeepers to some of the information. And if you're like Amin and you're going to maybe 3 different surgeries, you're going to see 3 different things. So I think that's a big issue. Making the app easier to access, so making login easier, including settings to remember the user. And one of the questions in the chat box is talking about why do I have to have a mobile number to log in? But we are going to have to go back out with some of these questions. Knowing that you can access from a tablet or a laptop, especially for those with physical disabilities who might need to use adaptive software. Confidentiality is coming out, but that's a theme I'm going to ask a question about. And providing clear paths to find help while using the app, which also includes some printed material maybe, and providing a clear, which is Amin, your comment about providing a clear explanation of the different healthcare apps available and how they all interact together. But I think that would take us quite a while to do that. So, Minal, I'm going to come to you with a question first of all, and I've kind of themed 3 or 4 of the questions together, and they're talking about accessibility for disabled patients, and how reasonable adjustments can be made, how access issues for people who can't use voice telephony, and easy read templates and formats for those with learning disabilities. So, Minal, do you want to answer that all about accessibility?
Yeah, so I think, accessibility is really, really important. I think we all agree on that. And I think, we could do a lot better on accessibility, and that's the journey that we've been on. I think what we are really trying to embed now is the conformance against the WCAG AA standard, which is the international standard for accessibility. And so that is part of the digital framework, and it needs to be evidenced now by suppliers about how they meet that the system is tested and how it meets that accessibility standard. We've also carried out accessibility testing through a specialist agency, which brings together users with different accessibility needs to test the different products. And we've produced reports and provided those to the kind of main providers of the digital access tools, and we're working with them to improve the accessibility of their products and make the required changes. And it is going to be a requirement, if you want to stay on a national digital pathways framework, that you are meeting the accessibility standards so that we are as inclusive as possible. And that includes a whole range of different accessibility needs.
Fantastic, thank you. And then, Mizan, I want to come to you because there's another theme in the questions around user support and feedback. And in particular, there was one question a patient said, when they had an issue, it was kind of treated as a complaint. And actually what they wanted to do was to be a system learning. You seem to have done a huge amount of things in working in partnership with patients to develop where you're at with your access.
Sure. Thanks, Rachel. So I think there are two elements to this. So there's one element that the practice has control over, of the overall appointment system. And then there's the IT product that's out there that the practice utilizes for their online consultation tool. So as far as the former, our overall system, how we can, for example, use the system and how we can adapt it. So as I mentioned, for patients who, for whatever reason, can't use the system, they might still want to come in as they did before, and that's fine. We have a dedicated member of staff who will sit down with them. If they want, they'll kind of teach them how to use it, or if they'd rather, look, we have some patients saying, look, I don't like this. You just have to fill it for me, and that's fine. We will do it for you too. So that's kind of a part of something that's within our remit to have that level of accommodation. And similarly on the telephone call too, some patients would just call and say, look, I want to book a GP appointment, and the team would go through the questions with them and complete the online form on their behalf. As far as the second part, and Rachel, I think this you alluded to, the system itself and issues with the system, that the truth is some of these systems are still quite clunky. Relatively, they're quite new. Some of them are a bit cumbersome. And if you saw my data, the one that had it was 65% satisfaction with the online system tool, and there were a lot of improvements suggested. And that's slightly, I have to be honest, that's beyond our immediate control. And that goes back to the IT team. There are different providers. We can obviously give that feedback to the IT team. And theoretically, we can compare the market and see what's out there and see if there are better systems out there. And these are conversations that we do have. There are some technicalities about which ones are commissioned and which ones aren't. And like most things, they'll come with advantages and disadvantages. My hope and aspiration is we're still in quite a relatively newish space. So I'm hoping that these systems continue to improve and be, there are iterative improvements too. So that part, in all honesty, is a work in progress. And the third thing I'd say is, I think it's compared to where we were, the old telephone system, where we are now is a lot better. I don't think we are where we exactly need to be. And that's a place where I'm hopeful that there'll be continuous improvements on.
Brilliant, thank you. And Cath, I want to come to you and ask a question on that as well. In that area, somebody suggested, under user support and feedback. And I know that we did some work with the NHS app and we did some videos quite a few months ago last year. How do you think the system could develop maybe video tutorials that people could watch and build their confidence?
Yeah, do you know what? A lot of people say that it's really difficult to access. You need a mobile phone number. There's been lots of messages in the chat and the Q&As about running into problems. I think, your NHS app account, because you can actually, the most predominantly used place to use the NHS app, I'll call it, is on a smartphone. But actually, don't be confused, it can only be used on a smartphone, because if you don't have a smartphone, you can actually create an account, an NHS account, on a computer or a laptop. But you know what? That there has been a lot of feedback saying it's really difficult, quite clunky. When you run into problems, you can't get past it. Do you know what? It's work in progress, like Mizan was saying there. We're taking all these thoughts and feedback on, and we're trying to make it easier. But the number one thing is we have to make sure it's secure, because your medical record's in the wrong hands.
I'm going to come to data in 1 second. I think this is more about just the video tutorials, how we can give patients more power to get into that.
So the NHS web pages on actually help guides are being made available more and more each day. The tutorials are on there. They've actually put out how to web links on how to download it and how to actually create an account, and that's a bit more easier than actually reading it from a poster from your surgery or a leaflet from there. So it's all going to be available. That's if you can get online in the first place.
Yeah, absolutely. And we need to thank Minal. Maybe we can talk more about some animations about the digital app, because they're so accessible. And we've done a couple.
Linking with your community. linking with your community groups is an amazing piece of, you know, the hidden gems in all of our communities, you know, third-party sectors. They are great advocates of getting people online as well, because they can see the worth of it as well. So.
Yeah, no, brilliant. There is some community connectors. And Manal, I'm going to come to you because I think the data question is really important, and we're seeing this across the healthcare system. And we did a piece of work with patients, and if one of the team could put a copy of the data pack into the chat box so people can see it, and it does address some of the questions about security of data and safeguarding, and Cath, what you were bringing in there, and it talks about addressing the questions that patients will have about data. We know there's public engagement around data happening shortly. An acknowledgement that the system is imperfect, and that things may happen. But what patients really want to understand is when that the system will acknowledge the mistakes and breaches, but also what would they do about it. So in terms of data security, Manal, is there anything you can add?
Just to say that, you know, the NHS takes data security really seriously. There's a code of conduct. There are really clear standards around information governance, confidentiality, and data use. You know, they are embedded across the NHS in frameworks and cybersecurity, as well as obviously a really key part of that as well in terms of protecting people's data. So I think, you know, that is there, and that is very, very clear. And I think we also recognise the real value, as described, I think, by Amin, really, about the importance of being able to share data with patients and access to their records, but also sharing data across care professionals to support direct care. So whether that's between primary and secondary care or primary and community services, and we've got shared records that have been being developed across the country to support data sharing to provide high quality, safe care and that information continuity, so people can make, you know, good clinical decisions.
Brilliant. And I want to come back to Amin's question, and I think I've heard this quite often around just general access across primary and secondary care, but I do think it's really important, you know, looking at how you can support proxy access to the NHS app for carers if they're named as carers, so they can, is that something in the pipeline or?
Yes, so the NHS app team and Transformation Directorate are doing a big piece of work on enabling proxy access, so watch this space.
Fabulous, fabulous. Okay, so now let's get to non-digital access, because I think we've had a real focus here. But you know, you started off, Minal, at the very beginning talking about, and Mizan, you brought that up, that there is other ways other than digital, and whilst digital is fabulous, there are still people out there who are going to struggle with it, and we have an increase in the number of people without Wi-Fi, but so how can we build on that digital? So there's level of questions around what safeguards are in place for patients who can't access digitally. We have heard, Manal, and you and I have talked about this, the odd GP practice, and I spoke with Claire Fuller yesterday about this, who are not offering phone access at the moment, but they're probably small numbers, but we do need to, you know, if that is an experience patients are having, I know that you and Claire and Manal want to know about that so that we can help address it. So we'll support you as much as that. And people not maybe wanting to talk about confidential healthcare issues over an app. How can we ensure that non-digital access for patients who really need it? Minal or Mizan?
Do you want me to start, Mizan, and then perhaps?
Yeah, sure.
Give a view. So I think, you know, we need inclusive access. It's all about having the 3 routes of access, because there isn't a one size fits all. And as I mentioned earlier, what we see is people using them dynamically. It's not even that if you use online once, you use online all the time, or if you go on the telephone once, you use telephone all the time. People switch access routes depending on their need. And all of those routes suit different people in different ways. And I would say that some people prefer online because actually it gives them a sense of digital disinhibition, and they feel like it makes it easier to share information that they find it harder to share, you know, talking to somebody. But as you say, Rachel, equally, it can work the other way. So we've got to maintain all 3 channels. They've got to be open, there's got to be choice, and they've got to be equitable, so that people can then use the channel that suits their need. But then that parity sits behind all of those. So regardless of how you access, you know, your need is assessed and prioritized safely and fairly, you know, based on what you need to be able to get you the right care, the right time from the right person. And so that's what modern general practice starts to describe and is investing in to help us move to a fairer, safer, more sustainable model. But at the heart of that, it is inclusive access. And we need to keep all 3 channels open.
Fantastic. Mizan, is there anything you want to say? We're down to the last minute. I just want to come back to Amin.
Yeah, Rachel, I'm aware of the time, so I just echo that. I think it's vital not to lose sight that digital is an addition to and not a replacement of the traditional ways of contacting the health force, especially in primary care. And trust is really, really important. And I think that patient trust is really vital. But I'm conscious of time, so I don't want to speak for too long.
This happens. Too much good conversation. There is more questions in there, but I think Hannah and Minal will pull these up, because there's a lot of questions about making that easy access. You need a mobile number, you need social ID, you need one or other, and that you are working on that. But I think that's obviously something that's going to enable a lot of people to access the app easier, which would be good. Amin, we have 2 minutes left as the patient carer representative here on the call. I think we answered questions that you put to the panel.
Thank you, Rachel. Yes, I think I'm not sure if I had any clarity on, you know, the question I raised about the research bit, where a patient can actually sign up, where this information are going and who will be using this information. And I got a few other questions. I'm not sure if time would permit.
No, we'll hopefully be able to answer those for you.
Okay. To Cath, I know you talked about the services. Since you have implemented the online services, you have noticed the significant amount of, you know, the drop in the waiting time, which is great. But has there been any sorts of patient and public engagement, especially to hear the voice of those who actually are unable to access those services, what they have to say and how they feel about whether they're feeling they're left out? And since the implementation of the online services, whether they feel the service has improved for them or it has been degraded?
I mean, that's a really good question. I think it's fair as well to say in general practice these days, how do you communicate out to our patients? And do you know what? The number one form of communication is actually digital, which again, for people who find it a barrier, this is a real problem. But in yesteryears, we used to send out letters or newspaper articles and things like that. It sort of doesn't work in today's society, and most people are accepting news in a digital format, however they get their news. So do you know what? We actually did an awful lot of promotion about our new ways of working and the NHS app through the digital way. And you know what? We've got great results. We have a great social media page on Facebook, and we get a lot of information out on that. And granted, not everybody is on Facebook, but we just, you know, we kept on at it. We kept on plugging that information. And that's, I think, the key to the game, is to get that information out there through whatever channel you can. You know, we do still send out text to people, but again, that's to people with mobile phones. So that small amount of people that we think that we're not reaching, the ones that don't have mobile phones, we actually send a small core amount of letters out to that key group. So,
And
you
of
know,
course,
we know we have to do.
And of course, the role of your PPG, the patient
Again,
participation group, is going to be fundamental in developing this. I am going to have to say thank you so much for attending. Thank you for all the questions. I tried my best to team them, and